Welcome back to the County News Podcast. I'm Nicole Weissman.
And I'm Charlie Ban.
And in this episode, we're talking about early childhood services. We have a guest, Boone County, Missouri Commissioner Janet Thompson, who's been tracking this issue over 12 years of engagement just at NACo alone, and of course in her own career previously, right, Charlie?
Yeah, she was, prior to being a county commissioner in Boone County, she was a public defender, and she got to see some of the downstream consequences of not having appropriate supports when people are early in the childhood.
She's going to share some interesting programming examples from Boone County. And then we also have NACo's own Kat Patterson. She's going to talk about NACo's Child Care Supply Network and some of our other work specific to this issue, right?
That's correct.
It sounds great. Let's get into it.
All right.
Commissioner Thompson, thank you so much for taking the time to talk. Tell me about Boone County, Missouri.
So Boone County, Missouri is located in the central part of Missouri. We're equidistant from St. Louis and Kansas City. We are a college town. Generally, with a big rural surrounding for that college town. We're the home to the University of Missouri Tigers, Mizzou Ra. And education is a big part of our environment here, put it that way. It's really important to folks. We have not only the University of Missouri with a strong education department and college, but we also have Columbia College, and we have Stevens College. And my first experience with early childhood was as a small child being brought here from the University of Michigan. So I was part of the Stevens College Learning Lab as a 1.5-year-old. So that was
you really got it on the ground floor.
I did, and so that's been part of my background, and probably has influenced what I've done since then. But Boone County again is a strong education county, and we live it, and we try to make it part of how we make things work around here. And sometimes we do it well, sometimes we can do it a lot better than we are now.
Obviously, even with a robust post-secondary education system and even primary and secondary system, there are a few years between when a child is born and when they enter the school system. How did you become aware of that gap, and and how Boone County seeks to fill it with programming?
So, when I first came to the county commission, I was a public defender for a really long time, and I saw those kinds of problems in my clients' lives, the lack of early childhood education, that access that would help kids and also help their families succeed. But I first became aware of it as a county commissioner within my first month of actually being on the job, because I attended a conference in Atlanta that was jointly sponsored by the U.S. Chamber of Commerce and NACo. And so it was fascinating to me to see and to hear about how important access to high quality early childhood education was to the U.S. Chamber of Commerce, and then to see how that fit in with a lot of the work that NACo was doing. So that sort of solidified for me the notion that, whatever we do, that access is critically important to success of young people and to the success of their families, because without that access, families themselves can't thrive, or at least can't thrive on the level they could if they had that access.
Wow, so that was your first month in office.
That was my first month. That was my first exposure to NACo, and what exposure it was.
But it also seems like you made a lot of connections between what you observed in your professional life and putting that together with that discipline and learning the formal background behind what you were seeing in practice.
Yes, it really. I mean, it helped me understand better why it was that my clients had not thrived. How my clients and their families and the generational involvement in the justice system for my clients had been impacted by, or perhaps molded by that lack of access, because you could see where families, if that's, everybody I think will understand on some level that if you want to make a change in a child's life, the biggest change you can make is providing access to high quality early childhood education. And then when you look at families that don't have that access, and you look at individuals that don't have that access, all of a sudden you see the disparities that are created in systems. And then you see the paths that people might take and communities might take when there is not that access.
So tell me about looking around at what Boone County offered at the time and learning what options you had on the table out there and how that's developed over the last 10 years or so.
So, we were very fortunate pretty early on, since I've been on the commission, to get involved again through NACo with the Prenatal to 3 program that was sponsored by the Pritzker Foundation. That was hugely important, and it wasn't so much access to high quality early childhood education as it was to build a foundation for families to be able to utilize that educational opportunity were it presented. So, what we did with that, and we have a robust health department. We have a lot of medical providers here, but we weren't looking particularly at that pregnant mom and those kiddos as they come into the world. And that was how the Pritzker grant helped us really focus on that piece of it, to say, what is it that that a mom needs to be able to move from the prenatal stage into that early childhood stage. And so that was a big piece of what we were doing. And we created a program that's called Brighter Beginnings, and it's now run by the health department. And it's a home visitation program that really looks at, healthcare issues, but it also looks at other issues in a family that you might need to connect mom with. So that was hugely important to us to look at. At the same time we were doing that, there was a group of folks here in Columbia, and that's our county seat is Columbia. The group of folks in Columbia who were saying, gosh, if a kid in a family can thrive, what's going to be the transition and the opportunity that's created for both that family and the community. And so they started looking at, how do we impact those kiddos? So at the same time we were doing this work on the prenatal to 3 stuff, there was a group of people that said, let's put in place and let's see if the voters would approve actually what's called a children's mental health tax. It's a creature of statute here in Missouri that is stunning in its ability to transform a community. The people in every early childhood and every educational organization knocked on, I think, every single door in Boone County. And that tax proposal passed with probably 10 to 15 points that they didn't even need to get it to pass. So that was in place as we started this work. And then we've through the years been able to utilize the funding that's been created by that tax to help to develop programming for children and families, because it's a children's mental health tax, but it's been broadly interpreted to include assistance to families, and a child is defined through their 19th year, so up to their 20th birthday. So we can do a lot of work that without that tax we wouldn't have been able to do. That just the funding has been stunning. And as part of that work, we've really looked at things like what does kindergarten readiness look like? What what does reading at grade level for third grade look like? What are those benchmarks that we know are important? What does that look like here in Boone County? And how can we put resources in place? What do we need to do to get more of those kiddos who are kindergarten ready, who are meeting those benchmarks? And so that's a big piece of what we've done as a community. And we've, combining the work that is being deliberately done on the early childhood side, we have combined that with, again, NACo. NACo's involvement has been the kind of the thread through this whole thing, but through NACo, we were able to successfully apply for and then participate in the first cohort for the Upward Mobility Project that was and it has been stunning. Urban Institute was a great partner with that and helped us to look at, what are the barriers to upward mobility? And again, what a surprise, access to early childhood education, that high quality early childhood education was one of the big markers for that, along with, access to affordable housing and workforce development. So those things are pieces that have been we've been working on right along through all of this process, sort of intertwined through our community services department and our partnership with so many other agencies in this county. I have to look back, and to me, the one of the transformative moments for me was when we were applying for the Upward Mobility Project to be part of that cohort, and the team that we put together to craft that application was very broad, and it included, it was business members, it was people from community action, it was United Way, it was our Chamber of Commerce, our regional economic development folks, it was healthcare, it was everybody coming to the table. And a good friend of mine, a guy named Steve Calloway, said, just remember, when you do this, don't do this to us, don't do this for us, do this with us. Mm-hmm. And that's been the model for all of the work that's been done, is making sure that that everything is done collaboratively, not imposing some external project on a community. So that's kind of that's our kind of messy journey. It's sort of the cartoon where the kid, where you trace the kid's journey from home to school, and it wanders a lot. Yeah, it is. Ours has been a family circus cartoon of getting where we are now, because we've had a lot of loops in the journey, and I'm sure there'll be more loops, but I think we're moving toward the goal. We're not there yet, but we've gotten some benchmarks achieved, and we continue to work towards the ultimate goal.
Well, one thing that struck me when you mentioned campaigning for the tax issue, that that proponents knocked on basically every door in the county. Not only was that a campaign to persuade people to vote for it, but there was also outreach to let people know that the county was trying to provide these services, which I imagine was probably more effective than any direct mail or newsletter. One way, and you got in contact with everybody. I'll put it that way.
Well, and let me be very clear: the county was not the organization that was pushing that. It was but I think that makes a real difference, because a lot of times when people look at something like that, they're like, yeah, right, government wants to get more money. This was people. One of the big movers and shakers in that was the Lutheran Family Services. That organization and I was running for office as I was doing my campaign for commissioner at the same time as they were doing this. And so I was going to doors where those folks, had been there. And so I got the benefit of listening to that and hearing, people say, gosh, what does that mean for our county? If we pass that, what does that mean? And that was really compelling to me because I got to hear how important people realized this was, that that their investment and it's a sales tax based program, their investment in that would improve their community. And it wasn't just their kiddo that was going to be able to thrive. It was their community. And it's like, don't you think that children deserve this opportunity? That why do we make a difference between the haves and the have-nots? And making, and why would we want a community of children who are less healthy than they could be, who are less educated than they could be, who are less happy than they could be? Why would we want that to be our community? Why wouldn't we want that opportunity to be there for every child?
Yes. As you've developed these programs, what have you been able to share with some of your peers, both in Missouri and nationwide?
So it's kind of fun when I go to a NACo conference and other places to talk about this. There's our children's mental health tax. It's 12 other counties in Missouri that have promulgated this kind of program. It's available by state statute. You have to get your county to vote it in, but our state legislature put this in place, and there's things that I would change, but by and large, it creates opportunities that that our county would not have been able to afford absent that program. And so that's one of the things I talk to people about, and then I tell them, this is something that you should learn from Boone County. Missouri is a very red state, and just like everywhere else, it's sometimes harder than heck to get a tax passed. But as you pointed out, it's when you have people out there talking to individuals, talking to voters and saying, this is the change that will be affected in our county if we do this. This is the opportunity we have to change the future of this county. And if you do that, they will vote for it, because it's really hard to say, no, I want an uneducated, an unhappy, and unhealthy community. That's what I want.
Yeah.
I don't think.
It also helps that the proponents articulate where the money will go. It's not just a slush fund; it is directly to fund this program.
Yeah, and it's one of those things that when you look at it, you can say these are the kinds of expenses that this money can be targeted for. It's case management. If and I always this is a conversation I have with the folks on that board all the time. I'm like, if I had a magic wand, I would say, let's put a lot of money into early childhood education, because that to me is one of the things that if you want to create that database, you can say what has the most opportunity for change, for transformative change, is when you put that money into early childhood education. And so I keep saying to them, guys, we could do a pilot and prove to people, prove the concept that that you're you're really going to change things. And instead of some of the programs that we fund, as I say, are pulling bodies out of the stream, but let's go upstream and see if we can make sure that those kiddos don't end up in the stream in the first place.
So what's next for Boone County and early childhood services?
So the exciting thing is, and we're about ready to break to actually start the building process. We are building a child care center on our public safety campus, and it's the goal is to collect the data, to look at the changes again that are we transforming lives? Are we transforming kiddos' lives? Are we transforming parents' lives and the trajectory of lives? And what we're looking at, we're also at the same time looking at just focusing eligibility for these positions in this childcare center to folks on the childcare on the public safety campus. So it's 911 telecommunicators who are typically of childbearing years, but hard as heck to hire because of their schedules, hard as heck to keep because for people of that age bracket, they're the ones most likely to be having the kiddos, but childcare is, as they say in my family, rare as hen's teeth and expensive. So how do we help that population transform lives and provide that access to a teaching environment where we really make sure those kids are kindergarten ready, make sure those kids are reading at grade level at third grade, make sure that we've hit those benchmarks. So it's for the 911 telecommunicators, it's for detention staff in our jail, and it's for our road deputies, because those, we're kind of looking at how do we address the early childhood issue and that kind of piece, as well as the workforce development piece that we know is a problem for those kinds of jobs. So that's in process right now. We have hired the first director for this program, and she is busily filling in the gaps so that we can begin to work and have our first kiddos hit that child care center next summer. And I'm really excited about that. And we've already begun conversations with folks about the data collection, because to me, we have to show to the community that this kind of investment works, and it works on various levels. We have to, because this is public dollars that will be expended, and so we need to show them that this kind of investment is something that we as a community need to replicate here in Boone County, but then replicate across the country, because it's so important. And you look at kids, and to go back to the beginning, I was blessed. My mom was an emergency room physician, so she couldn't take care of me when I was itty bitty. She was in the ER. So I was at Stevens College nursery school, what they called a nursery school back then. But I was reading by age 3 and 4 because I was in that setting. And so I know from my own personal experience that makes a difference. So we've got to make that the model for every kiddo, make sure they have that opportunity, and then say, look at the data in terms of the families, what changes does that kind of program affect on the family? Does a family member, an adult in that family, get further education? Is that family member able to buy a home rather than rent? What are the changes that we've made in the trajectory of that family in our community? So we're committed to the data collection, because that's critically important to make sure to ourselves that we're meeting our goals, but also to the community to say, yeah, to the business community, yeah, the water isn't bad. Jump in with us.
Yeah, and it's truly a two-way investment. Obviously, you're investing in the children of these staffers, but you're also able to recruit a wider range of staffers for those three departments: the road officers, the 911 center, and detention officers. These you're that much more of an attractive employer as a result of this benefit.
Exactly, and it's retain. It's hire and retain, because those are areas that it's hard to keep those people there, and especially for all three of those, we're hiring. And across the country, when you talk to people, their 911 telecommunicators are typically young people. Their detention staff, typically young people. Road officers, typically young people. So how do we hire them? How do we keep them? And we know that childcare is just super expensive and hard to find. And we're also building this at this point from 5 a.m. until about 11 at night. So it's not going to be the full time, but we anticipate moving it to a 24/7 operation.
Wow.
Yeah.
I can't wait to see how this turns out. Commissioner Thompson, thank you for joining us today.
Well, thank you for the opportunity. We would love to have you come and check it out next summer, because it's going to be an exciting day for Boone County.
Did that go for everybody listening?
You bet. Come on down.
All right. Thank you so much.
Thank you. Be well.
Now we're joined by Senior Program Manager Kat Patterson from NACo. Kat, tell us about what you do at NACo.
Thanks, Charlie. So I am our Senior Program Manager for Children, Youth, and Families, where I lead our programming related to prenatal to 3 policies and practices, and really supporting county officials in everything they do when it comes to improving the health and well-being and safety of children and their families.
You've heard that interview with Commissioner Thompson. What do you think about what she has to offer as a child care leader in NACo?
I still appreciate how much authenticity she brings to her work and her personal experience as a public defender. And really, I think it brings forward just how important that systems level awareness is. And I think as a champion for children, youth, and family well-being and safety, she really shows just how clearly so many of these issues are interconnected.
Obviously, she's got about 10, 12 years of experience working with NACo on early childhood education. Not everybody can start with that much experience. How can NACo help interested county officials get involved in that realm and learn more?
Absolutely. That's our bread and butter. We offer any number of resources and programming to support officials who are working on these issues. We have a variety of publications that we produce over the course of the year, things as easy and as simple as newsletters, all the way up to regularly convening learning communities and peer-to-peer learning cohorts, whether that's virtual convenings or in-person full day and a half opportunities to convene in host counties to see programs in action. We really have an entire spectrum of activities and resources geared towards supporting officials who are doing this work.
We're going to be having a convening or a peer exchange in Cuyahoga County in the last days of September. It's obviously a little late to get on board with that, but what will some of the attendees be doing in Cuyahoga County?
Of course, we are going to be touring a couple of childcare providers. We're going to be seeing some programs in action. There's lots of team-based discussion and cross-community discussion. So really encouraging that peer-to-peer connectivity, that resource sharing and relationship building. So really looking forward to deep diving on the issue of childcare supply building, but then also just really facilitating those opportunities to learn from each other and to spend quality time with colleagues doing this work in other communities.
Sounds great. Well, thanks for joining us, Kat.
Thanks so much, Charlie.
Thank you for listening to the County News Podcast and our episode on early childhood services. One quick PSA, if you're interested in upcoming campaigns from the National Association of Counties, November 4th through the 11th is Operation Greenlight, an opportunity to participate in lighting up county buildings and landmarks in green in recognition of veterans in our communities. To learn more about that program, visit NACo.org. And of course, visit NACo.org and follow us on social media for all sorts of resources related to today's podcast and future podcast episodes.